Okay, so I want to talk about arthritis for a minute and help get rid of some of the myths and sort of limiting beliefs around successfully managing arthritis, and more importantly, helping to get rid of a lot of the pain that's associated with arthritis, because the pain from arthritis, leads people to stop doing their favorite activities, and it definitely leads people to maybe getting things like surgery, especially total joints, sooner than maybe they need to. And sometimes you can avoid these things altogether. If you're not familiar with who I am, I'm Dr. Carrie Jose. I own CJ Physical Therapy and Pilates in downtown Portsmouth, New Hampshire. And we help people over the age of 40 deal with things like arthritis, as well as any other kind of pain or injury that's keeping them from doing the things they love to do. So our mission and our focus is to help people, if you're over 40 listening to this, just like you, be more active, healthy, and mobile without having to rely on pills, procedures, and surgery. So that's what we're known for. That's what we love to do. And the topic of late that has been coming up a lot, I think it's because we're in New England. It's the winter time here. So because of that, people's joints are talking to them. So lots of questions about arthritis have been coming up lately. And, I want to share with you kind of what I tell people. So the first thing is to really understand what arthritis is. The first thing is that once you hit 40, it's going to start to show up on an x-ray, whether or not you have pain. That's really important, because what that means is that essentially, and I'm talking about osteoarthritis, by the way, there's other forms of arthritis. We call them inflammatory types of arthritis, such as rheumatoid arthritis, and like ankylosing spondylitis is kind of like an arthritis type of condition. But we're talking about the osteoarthritis, the kind that you think of when you think of arthritis, aching and stiffness in your joints. It most commonly affects your knees, okay? That's the most common, but it can happen anywhere, all right? So with arthritis, the thing to know is that even as soon as age 40, you can start to see this show up on an x-ray. And why that's important is because most 40-year-olds aren't feeling the consequences of their arthritis yet, or they're not feeling the actual arthritis that's starting to form in their joints. Most people don't start complaining about it until maybe closer to mid-50s, and definitely once they're in their 60s and 70s, okay? So it happens slowly over time, and what that really means is osteoarthritis in particular is a natural part of aging, and that's really important to understand. And when you understand that, you can do things way sooner to mitigate it and get in front of it, okay? Such as making sure that you're optimizing your joint mobility. That's really important. Movement is like lubrication and lotion for the inside of your joints. What gets most people into trouble is when they stop moving. So why that's important is because you need to understand that no matter what that x-ray says, okay, or what that image says, movement is the best medicine for you. Movement and exercise. No matter what study you read, no matter, what kind of research you look at, this notoriously shows up at the top as one of the best medicines, not just for arthritis, but for so many things. Exercise is your best medicine because it builds muscle, keeps blood flowing. We have natural healing agents in our bodies and in our blood. And when you keep all that flowing and circulating, you're doing good things for your body, including the arthritis that's in your joints. And when you have strong muscles, that supports your joints, which will make the effects that happen later in life from just as arthritis advances, it's going to make them less of an issue. So no matter what anyone tells you, one of the worst things you can do for arthritis is to slow down or stop doing things you love to do. Even things that produce load on your joints, such as lifting weights, or even if let's say you're a runner. If you've been a runner your whole life, you've always kind of ran without issue, and then maybe suddenly you get knee pain and you go to the doctor and he says, or she says, it's arthritis. You have to understand that that arthritis didn't just show up. It's likely not the source of your knee problem. Your knee pain from running, something like running, is probably from something else. And it's important that you get that figured out before you go and start blaming arthritis and then stop running, because they've done studies where runners who keep running have less degenerative changes, aka arthritis, in their knee joints than non-runners. So, running isn't evil, it's not a bad thing, but if it's causing you pain, you do need to check it out. You just don't want to make assumptions based on an x-ray that arthritis is the reason for all your problems, okay? So movement, exercise is one of the best things, and you want to make sure that you're getting the full story, because you have to understand that arthritis is going to happen to everyone. It happens no matter what. It happens as you age, but not everyone with degenerative changes in their joints has pain. That's confusing. We talk about that a lot in the office. I write articles to try to talk about this topic. You can see them all on our website, cjphysicaltherapy.com. I write a weekly newspaper health and wellness column for the Portsmouth Herald, and every one of those articles goes on our website for people to read. So if that's something that you want to learn more about, just go on our website, cjphysicaltherapy.com. It's a little search bar, search for the topic that you're looking for, and you'll find all the blogs we've written come up. So that's just an added extra free resource if anything I'm saying is like intriguing you and you want to learn more about it. But all that to say, two things I've talked about so far. Arthritis is normal. It occurs normally as you get older. It's going to show up on an x-ray no matter what, whether or not you've got joint pain. You want to be careful not to just blame arthritis for what's going on, especially if a problem suddenly appears. Sometimes arthritis really is the problem, but you want to let experts figure that out. And I'm talking like movement, physical therapy specialist type experts. People understand this concept of mechanical pain, arthritic pain, what is arthritic pain, what isn't arthritic pain. Not that doctors are bad, they're very good at what they do, and you want to go to one when you need one, but they make their decisions typically based off of images, and they don't always look at the full picture or the full body, and that's really important. You don't want to miss that. So arthritis is normal, starts around 40, it's going to show up on your x-ray whether or not you have pain, okay? Knee pain is the most common form of arthritis, but you can get it anywhere. Movement and exercise is your best medicine, not just for arthritis, but for so many things, okay? And then some other things you can do if you're trying to decrease pain that's associated with arthritis, just living a healthy lifestyle, right? Or just trying to do things that maybe if you're a little bit overweight, losing weight will help you. Okay, you're going to feel better. You'll have less inflammation all around in your body. You'll be able to exercise more, which is the best medicine, that thing that's going to help you. And the last thing I want to talk about is sometimes people don't start addressing their arthritis until it's kind of too late. Like they've just let this go way past where it needed to be. So for those people, a lot of them resort to cortisone shots, which is, you get an injection of cortisone into your joint and it kind of like blasts out the inflammation and, hopefully you don't have any pain after. Sometimes they work, sometimes they don't. But what's more important to know is that cortisone shots aren't great for your joints, especially if you're getting them over and over again. In fact, they'll increase your chances of the arthritis advancing, and then you definitely need to get a total joint, okay? The other thing is they cause damage to tendons and things like that when you keep getting cortisone shots, okay? So the other thing that sometimes people get for their joints as a precursor to like a total knee replacement, let's just say, since knee pain is the most common, we'll just talk about that. A lot of people like to get arthroscopic surgery in their knees. That's another thing that if you can stay away from it, you want to, because if you're getting an arthroscopic surgery to avoid a knee replacement, the studies actually show that arthroscopic surgery, especially if you get it more than once, actually fast tracks your way to a total knee replacement. And just so you know, I don't think total knee replacements or any total joint replacement is inherently bad. I just think they're overdone, and there's so much you can do before you get to that surgery. Because if you can keep your original parts, that's the best thing, right? So you don't want to get surgery unless you have to, because once you go down that road of surgery, you do open up the possibility of risks and unintended complications like infection and things like that, which then, recovery is horrible, and now you've got a whole other set of problems. So that's why we try to help people avoid surgery so much. But back to cortisone shots. So there are other better ways to manage inflammation and help that arthritic pain, dissipate and actually kind of help the inside of your joint heal a little bit more. Because what they theorize is that the pain you get from arthritis is actually due to what we call bony edema. So it's like inflammation, like almost like in the bone, deep inside the joint. And that inflammation is what's causing you pain. So rather than take a cortisone shot that is unhealthy and just blast it out, your body is capable of clearing inflammation and healing itself. So we want to support that process and help give your body a boost. In our office, we use a combination of something called shockwave therapy and EMTT, which stands for extracorporeal magnetotransduction therapy, okay? When you use those two therapies combined, it stimulates blood flow, it stimulates all the natural healing agents in your body, and they target that area, the area where you're having the arthritis, to help healing and manage the inflammation at the cellular level. So inflammation, when your cells get a little gunky or stuck because of maybe some chronic inflammation, or your body just not like doing what it needs to do, the bad fluid gets kind of stuck, and that needs to go out of the cell so good fluid can come in. And when that process gets stuck, you end up with chronic inflammation. So the EMTT helps to kind of reset that cellular membrane so that this fluid exchange can happen. That sets the breeding ground, if you will. I call it fertilizer for your cells, so that the shock wave can work even better and last longer. And the shock wave is the thing that heals tissue, and bone is tissue. So those are some better alternatives, I think, than going to cortisone. And let's say you are going to get a knee replacement surgery or any kind of surgery, using shockwave and EMTT together before your surgery actually sets you up for a better recovery. We use it after too. So those are just some of the ways that we help people and how we advise people who are dealing with, arthritic pain in their joints. These are the different ways that we help people heal and, manage their pain naturally so that ultimately they can exercise, which is the best medicine, and keep doing all the activities they love. So if that's you and you're listening to this, maybe you're hearing some of this for the first time, I encourage you to, do your own research, but, this gives you a good place to start. Feel free to visit our website, cjphysicaltherapy.com. We've got a ton of free resources and free information on there about this topic and much more. And if you're local to us here in Portsmouth, New Hampshire, reach out. I'd love to hear from you. And if you're looking for help, maybe a good fit for our services, we'd love to talk with you and see if getting help would be something that would be good for you. But yeah, that's all I got. Arthritis, topic of the day. Wanted to tell you a little bit about it and give you hope that, there's other alternatives besides cortisone shots and surgery. You don't have to do those things if you don't want to. I don't recommend them being your first, line of attack for an arthritic joint. There's so many other things to do and try first, and many of them can be successful, and they're non-invasive and much more natural. But the North Star, the goal, is to get you moving, doing exercise, because that ultimately is your best medicine for everything, not just arthritis, for your whole entire body, for longevity, for your health, so many good things. But if pain is keeping you in the way from exercising, we got to problem solve that and get you feeling better. Okay, Dr. Carey signing off. That's it for me. I hope you guys are having a great day, and I hope this was helpful. Do me a favor and give this video a like and subscribe to our YouTube channel if you found this helpful. All right, bye.